Hi, I'm Selena Scudder, and I did my case study 4 on a patient named DM with cystic fibrosis. A description of DM's condition: he was diagnosed with cystic fibrosis as an infant. Cystic fibrosis is a hereditary disease that affects the digestive system and the lungs. The disease causes the body to create a sticky and thick mucus that can back up the lungs and clog the pancreas. My patient DM is 15 years old and he's 5'9" and he weighs 108 pounds, which is considered underweight for his gender, height, and age. He has a blood pressure of 114/68, which is in the ideal blood pressure range, but it's important that I keep an eye out for his diastolic blood pressure anyways, because if it hits 60 and below, his blood pressure is considered low regardless of what his systolic blood pressure is. He also has a total cholesterol of 155, which is considered good, and an HDL of 55, which is normal as well. Although his HDL is considered normal, it could be higher. His HDL levels are another important factor for me to monitor throughout his time with me. His digestion is adequate enough to not have a gastronomy tube that will make things a lot easier. This will make things a lot easier when prescribing his exercises. So the medication, in DM's report, it mentions that he is on a few medications such as albuterol. I'm not really sure how to pronounce a lot of these, but I'm going to try my best. Dornase alpha and prednisone. Albuterol is used to help prevent and treat shortness of breath and wheezing. This medication should not cause any complications during DM's workouts. If anything, it should really help him when performing his exercises, because albuterol is also used to prevent exercise-induced asthma for a lot of athletes as well. Dornase alpha is used to improve lung function in people with cystic fibrosis by breaking down excess DNA in the pulmonary secretion. This medication is reducing the risk of respiratory tract infection. This should not affect DM when performing his exercises and is very beneficial for him. Now, prednisone is used as an anti-inflammatory medication. This medication does have some severe side effects such as seizures, feeling shortness of breath, rapid weight gain, low potassium that can lead to an uneven heart rate, high blood pressure. So it's important, honestly, when he is on that medication, I recommend him not even taking it before workouts, just so that that doesn't prevent him from getting through a workout. DM's evaluations. So exercise is very important for those with cystic fibrosis because it can benefit their overall well-being. Exercise can increase exercise tolerance, respiratory muscle endurance, increased muscle mass endurance, lower risk of fatality. This is a goal of mine for DM, just to kind of improve his overall well-being along with all the others. With that being said, the exercises I prescribe for him will not only be to build strength and muscle mass, but help increase his VO2, improve aerobic capacity, cardiac output, and cardiorespiratory endurance. DM's medication should help him throughout this time we have together, because his medication is supposed to help with shortness of breath, wheezing, upper respiratory infections, exercise-induced asthma, and everything that I had mentioned before while going through his medications. But again, it's important to monitor him to prevent any risk. With that being said, the exercises I prescribe for him will not only be to build his strength, muscle mass, but to help increase his VO2, and again, improve his aerobic capacity, cardiac output, all that. Now, things to keep in mind, like risk factors, before beginning his training, it is important to note his risk factors and exercise guidelines to abide by when prescribing his exercises. It is important to monitor his heart rate and blood pressure throughout his workouts, because cystic fibrosis affects the lungs and can cause DM to have trouble breathing, which can affect his blood pressure and heart rate. Also, his medication, prednisone, comes with a lot of side effects. and that can affect his heart rate and blood pressure as well. So communication will play a big role in DM's success while he's working with me. Because of these risk factors, he will need to communicate with me when he feels overly fatigued, nauseous, dizzy, out of breath, etc. I also need to keep in mind that he is not active, so the exercises I prescribe for him need to be thought out well so that I'm not pushing him too far past his limits, causing him pain and or too much discomfort or injury. Exercise testing. Now I'll be giving DM an exercise test to measure his muscle strength and endurance, range of motion, oxygen consumption, and cardiorespiratory endurance while performing his exercise test. The test I will be giving him will be the cycle ergometry test. Because he does not exercise, I thought it would be the best to give him the bike test instead of having him run. I can collect more data with the bike test anyways because I can test his VO2 and muscle strength and endurance. I will test him until he reaches a certain RPE. After every 2 minutes, I will increase the workload and ask him how he feels, how hard he feels he's working on an RPE scale. When he gets to the RPE of 15, I will stop the test and check the timer and see how long it took him to get to that RPE. I will be testing his VO2 max as well. So I'll be putting the mask on him, making sure that he's comfortable, make sure I have that secure while he's, taking the bike test. To test his range of motion, I will be using a goniometry test, which is an instrument that measures angles at the joint. I will also be having him do a sit and reach test to test his flexibility. To test his muscle and strength endurance, I will be having him do body weight exercises to test his lower body, such as squats, forward lunges, and to test his upper body strength and endurance, I will be having him do some band work such as like band pull aparts and tricep curls, like using the band until failure. The exercises prescribed for him. I'll be working with him for 12 weeks, which is 3 months. He'll be meeting with me 3 days out of the week. I will be meeting with him every Monday, Wednesday, and Friday. On the days that he's not with me, I will be recommending some classes like pool exercises that can work on cardio. I'll be recommending yoga to help with his flexibility, range of motion, classes like that. Even like a step class, to get his heart rate up for cardio as well. On Mondays, we'll be working on upper body and cardio. Wednesdays, we'll be working on, Mondays will be lower body and cardio. Wednesday will be upper body and core. On Fridays, he'll be working on range of motion, cardio, and core. We will start with 30-minute sessions, and then as he progresses, we'll work our way up. On the days he's not working with me, as I said, I'll be recommending some other classes and exercises that he can do at home. Also, I'll be recommending something that he thinks is fun, like maybe going outside, taking a walk. If he has a dog, walking a dog, maybe playing a sport that he enjoys. Before each session, he'll be having an 8 to 10 minute warm up, along with a 5 to 10 minute cool down. So his warm up will consist of butt kicks for 25 seconds, high knees 25 seconds, pull up, stretch down 5 times each leg, karaoke, 10 yards down, 10 yards back, Spider-Man stretch, hold for 3 seconds while you're down for 4 times each leg, jump rope for 1 minute, forward lunge 10 yards down, and then just walk back, and then quad pull leg kick 5 times each leg. He'll be doing a cool down, which will consist of walking around the facility for about 2 minutes, and then start doing some stretches, as in bending over, touching his toes left and right, but holding those stretches for 15 seconds. Butterfly stretch, holding that for 15 seconds. Pulling the arm across the chest region and holding that for 15 seconds. You'll do that for 15 seconds each arm, and then reaching up high just to kind of open up the lungs for 15 seconds. The warm-up and cool down is to prevent any kind of injury and to help with soreness. So again, Wednesday, and Fridays, Mondays will be working lower body cardio. I need to fix that. There you go. Lower body and cardio. Wednesday will be upper body and core. Friday will be range of motion, cardio, and core. Now I put months 1, 2, and 3 together. So the intensity for the first month is that he's worked with me. He'll start out with resistant bands and lighter weight, and then obviously as the weeks go by and the months go by, the intensity will increase, and they'll be using harder resistant bands and heavier weight. Okay, so Mondays again for lower body, he'll start off with his warm up, and then for lower body, he will be doing resistant band squats, 3 sets of 10, dumbbell forward lunges, 3 sets of 5 each leg, with 5-pound dumbbells. And if that's too heavy, then go into 2.5, or maybe just body weight. Band RDLs with the lightweight, 3 sets of 10, weighted glute bridges, 3 sets of 8 with a 10-pound weight resting on his abs. And for cardio, he'll just be riding the stationary bike for 10 minutes. For Wednesday, again, he'll have his warm-up, and then his upper body, he'll have a resistant band bicep curls, 3 sets of 5 for each arm with a light resistant band. He'll have dumbbell overhead press, 3 sets of 6 with 5-pound dumbbells, dumbbell tricep kickbacks, 3 sets of 5 each arm with 5-pound dumbbells. And if that's too hard, then we'll lower the weight. And then resistant bands, I's, Y's, and T's. And that'll be 3 sets of 4 each way. And then for core, you have crunches, 15, Russian twists, 10 each way, toe touches, 15, and then plank for 20 seconds, and he'll repeat that twice. And for Friday, which is full body range of motion, he'll have flex and extension with his arms, 3 sets of 5 each arm, abduction and adduction, 3 sets of 5 each arm, and outward inward rotation at a 90-degree angle, 3 sets of 5 each arm. For the lower body, same thing, flexion extension with his legs, 3 sets of 5 each leg coming from the trunk, flexion and extension of the knees, 3 sets of 5 each knee, adduction and abduction, 3 sets of 5 each leg coming from the trunk. And then cardio, he'll do a light jog interval with jogging for 2 minutes on the treadmill and then walk for a minute. He'll do a total of 12 minutes. And for core, he'll hold 6 inches for 15 seconds. He'll have bicycles, 6 each side. Side planks, he'll hold that for 15 seconds each side, and then he'll have penguins 10 times for each side, and he'll repeat that twice as well. So for an exercise summary, he'll repeat these exercises each week along with other harder and more complex exercises. My goal for him is to reach one more level on the RPE scale every 1 to 2 weeks. I also want him to move up weight every 2 to 3 weeks and start running more and longer distances, and to increase his flexibility and VO2 every 3 weeks when he is tested until the 3 months are over. And then when I say tested, at the end of each month, I will be retesting him with the exercise test that I gave him to begin with.